My name is Connor, and today I will be demonstrating how to give a baby a bath. To start, you'll get the turtle tub, and you want to fill it up to about this bumper. You want to use the temperature gauge on the inside to ensure it is not too hot or too cold. You also want to have this liner on it. So go ahead and you'll place it in the sink. And you'll fill it with warm water, again checking the temperature. Make sure it goes only up to that bumper. When you're giving a bath, you want to make sure to never turn your back on the baby. You always want to make sure you can have your hand on it if you have to. For the first bath, you'll need to wear gloves. But after that, it is not necessary. You want to take a blanket and lay it down so he can be wrapped in it. It is a little weird that, it may seem a little weird that you're putting a baby in a blanket to give it a bath, but they like it, helps them feel secure. Go ahead, lower him into the water. Now when you're cleaning the baby, you can make sure you're using baby bath soap. You don't want to put the soap directly into the water. You also don't want to use any powders or any oils. The powders can be harmful to the baby's lungs, and the oils can clog the pores of the baby's skin. You also want to give the baby a bath only about twice a week. More than that can harm the baby. So to start, you'll take your washcloth, dip it in the warm water. You're going to start at the face. You want to think when you're cleaning, clean it dirty. And top to bottom. So you'll start with the eyes. For the face, you're only going to use warm water. You're not going to use soap. So you start at the eyes and you go from the inner canthus to the outer canthus. You switch it. Get a clean spot in your rag. Go from the inner to the outer so that way you're not contaminating anything into the eye. And you'll just wash the baby's face with some warm water. You want to make sure to get behind the ears as well. When you go to wash the baby's ear itself, you want to make sure you put nothing smaller than your finger into the baby's ear, as it can harm it. So you just wrap your washcloth around your finger, just go into the baby's ear. Then we'll start going down to the chest and neck. I'll put a little bit of soap under my glove. Soap the baby's arms and chest, making sure I get into his neck folds, hands. Once he's all soaped up, I'll take my washcloth with the water, just go ahead and wash him off. I'll go down to the legs and feet and do the same thing there. The peri area and the butt should be cleaned when you're doing the diaper changes, so it's not necessary to clean them now. Go ahead and lift them up for the back, make sure to support the head, and you can just wipe down the back. You'll want to have a clean towel laid out to put the baby in. Pick him up. Just lay him down onto the towel. And make sure to wrap them up in the towel. At this point, we're going to wash your baby's hair. You should wash your baby's hair every single time you give the baby a bath. Football hold is a good hold for this. You're making sure to support the head. You can use the same water as long as the baby didn't have a bowel movement in it. The same water should be fine. You'll take the soap, put it on your hand. Make sure to wash the baby's hair nice. You won't hurt the baby's soft spot, so you should make sure that you're washing the hair. And you take your washcloth and we'll go ahead and set him in the crib. I'll open this up. While we're here, we can talk about pericare. So for an uncircumcised male, you do not want to retract the foreskin. You're going to want to clean the peri area with just some warm water and make sure it dries at every diaper change. The important thing is to not retract the foreskin, it's going to hurt the baby. For a circumcised male, for the first 24 hours, you'll take a 2x2 and some petroleum jelly, put it a little bit on the 2x2 and place it over the baby's penis before you put the diapers on to keep it from sticking. You're going to want to look for signs of infection and call your doctor if you find signs of infection. That you might see a white or yellowish exudate, that's normal. You also want to observe for signs of any bleeding. For a female, when you go to wash your peri area, there might be a white cheesy-like substance. That's the vernix, and that should be able to be washed off. That's normal. She also might have some discharge and or blood. That is also normal for the first day or two. She should just be withdrawing from her mother's hormones. You always want to make sure you go from front to back when you're wiping her vagina, so as not to get fecal matter up into it. You also want to, if you're doing multiple strokes, you want to switch to a clean area of the cloth every single time, or switch to a new wipe as to keep from contaminating her vagina. Now for diapers, you should be doing 6 to 8 diaper changes per day. A good rule of thumb is to check just every time they've eaten, or every time it's a feeding time, check to see if the diaper needs to be changed. And just go ahead and lift up the legs here. You want the sticky sides on the back. Ooh, I'm sorry, before we do this, I got so into the education about the peri area, I forgot to remove the towel. So move the towel and we would throw it in a hamper without leaving the baby. And now we can do the diaper. So we'll lift up the legs, put the areas with the stickies on the back. We'll pull up the front. When you're doing this, you should be looking for signs of like redness or a rash. And you want to clean this area with warm water and make sure that it stays dry or after you wash it at every diaper change. And while he still has the umbilical stump, you're going to want to make sure to fold the diaper down so it doesn't irritate the umbilical stump. It should fall off in about 7 to 10 days. It might turn a little black at the end. Just be aware of signs of infection or bleeding. All right, now it's time to get the baby dressed. So we'll be using a Halo Swaddle, which is part of the Back to Sleep campaign, and a little baby shirt. So we'll go ahead and put the shirt on first. And now this Halo Swaddle, it zips from top to bottom, so that way the zipper's not up here and bothering the baby. So we'll go ahead. Go ahead. You put his feet in first. Cover those up. And now this inner part has these 2 armholes, so you're going to pop your baby's arms through these holes. And go ahead and zip it up. Now that it's time to wrap, you're going to want to cross your baby's arms across his chest and pull it tight. Make sure he's nice and snug. So to minimize the risk of SIDS, you always want to make sure the baby lies on his back for sleeping, never on the stomach. the only time he should be on his stomach is if he's supervised. You want him to sleep in the same room as mom and dad, but not in the same bed. You want to keep the child out of in an environment that's free of drugs, alcohol, and smoking. You want to make sure there's nothing in the crib with him, no blankets, no pillows, nothing like that. A pacifier at night can help decrease the risk of SIDS. You need to make sure he is up to date on all of his immunizations and vaccinations as well. You also don't want any home monitors or wedges or anything for the baby. The 3 holds for the baby is the football hold, which is good because you have a hand free. You can do the upright hold, and you can do the cradle hold, which also lets you have a hand free.